Question: is our healthcare system fixable? Unfortunately, my answer to you is probably not. But the good news is your health fixable? And is your personal healthcare system and plan fixable? Absolutely. Absolutely. And here's why. Now, these are 3 things you're going to have to do, and you're going to have to make some changes if you're going to be effective in improving the health of yourself and your family members. Number 1, you're going to have to, first of all, change your thinking. Now you say, what do I mean by that, Dr. Clark? You got to learn to do this. Ask why. Oh, I love that. Why? It's never even discussed in conventional healthcare today. But when you have a health challenge, you should be asking yourself, number 1, why do I have this? And number 2, okay, if you are not in a health challenge or if you're just cruising along, either way, you should be asking, what can I do to maintain my health and to get healthy again? So first of all, let's deal with why. Whenever you begin to have any kind of health challenge, you need to search yourself and look into what you already know, first of all, because there's some things that you already know. What am I not doing that I know I could be doing in order to get healthier? Number 2, there's some things that you don't know yet, and you're going to have to learn. So you say, okay, I don't know how to get out of this crisis. I don't know why my body got unhealthy. I need to do some study. I need to put some work into this. How can I get my family healthy and keep them healthy? You need to learn. Number 3, some things you're going to need a coach. In other words, you're like, I can't figure this out. I need someone to walk me through this path. I need someone to walk before me in health and in wellness. And that's what I do. That's what I've spent my life learning to do, is not only get myself healthy and to get my family healthy, okay, but also to teach other people how to do the same thing. So, learn to ask why regarding your health. Practice what you know, learn what you need to, and get a coach to help you when you can't figure it out. The second thing, very, very, very important, okay, is that we need to base our healthcare decisions and choices on results over price. I'm going to tell you this, the most effective, cost-effective healthcare to you, for me, is the one that works. We think, oh, the least I spend, the least price is going to actually, is going to be best. No, you know what that is going to actually, when you base your decision on price, you actually have increased cost. Now, you say, Doc, those are the same thing. No, they're not. Price is something you pay. Cost is something that in one time price is gone, cost continues to go on. In other words, you make the wrong decision here, and now you got to pay for it in bad health, maybe for years, decades, or even the rest of your life. So my point is, you have to look at what works. What works will always be not only your best form of care, but also the most cost effective. Okay? And then the third thing, very important, you must have the proper use of insurance. Insurance is necessary, but it's for crisis. Okay? Crisis care. Okay? Emergencies. Catastrophes, accidents, things that happen. It's never been about health. Guess what? No insurance is really about prevention, maintenance, wellness. Your car insurance doesn't pay for you to change your oil, does it? Does your house insurance pay for you to keep your gutters clean so that you don't have a roof rot? I don't think so. No. So you got to look at health as something that's outside of the insurance realm. If you go in the insurance world, they're only going to deal with crisis. And do you want to always be in a crisis? I don't think so. Nobody wants to do that. So there's 3 types of health care, okay? Number 1 is self-care. This is the most important part of care. We talked about that up there. Number 2 is health care or wellness care. This is really true things that improve. This is where a coach and a wellness doctor can help you. And then number 3, right here, this is where we got now emergency care, okay, or crisis care. You don't want to be down here ever, but if you have to be, you thank God you have insurance, okay? But that's all that you should be using it for. The rest of it, you should be thinking about, how can I get the best results for the money that I'm going to invest? Learn all you can, and then get somebody to help you with what you don't know. If you do this, you can actually fix your personal health issues and improve your healthcare situation, regardless of what happens with the system that we have here in our country. So, I'm interested to know what you think. As always, put your comments below. Subscribe to get more information if you like this. And if we can help you in our office, give us a call. Click the link below. Live life well, and God bless.